Hello, I'm Dr. Ellie Harrison. Meet in Paranisten.
Why does my body feel heavier like this? I eat fruit every day. They said eating like this would make me healthier. But for adults over 60, certain fruits can quietly damage the kidneys. Really? Fruit? I've been eating it every day, and that's the problem. Have you ever believed that eating fruit every day is the best kind of health care? Yet you still feel your body getting heavier and heavier. Many people in Korea think that eating an apple in the morning, having a banana after exercise, and drinking a glass of orange juice in the evening will replenish vitamins and make the kidneys healthier. But strangely, as people get older, they often notice their legs swelling, more foam in their urine, and constant fatigue for no clear reason. Some people even wake up at night with pain on both sides of the lower back, yet they dismiss it, thinking they simply slept in a bad position. So a question naturally arises. Could the very fruits we have trusted like a cure all be quietly harming the kidneys after the age of 60? And if that is true, why do so many people fail to notice it at all? After meeting older patients for many years, there is one thing I have always found especially heartbreaking. Koreans do have a good habit of eating fruit, but they often choose the wrong time, the wrong type, and the wrong amount. This confusion becomes especially dangerous after 60. The kidneys at that age are like a filter that has already worked for more than half a lifetime. By that stage, kidney function has often weakened significantly. When I ask older patients when they eat fruit, most answer like this. You should eat it when you're hungry so it digests well. I need to eat a little every evening so my stomach feels refreshed. Fruit is good, isn't it? If it's there, I just eat it, doctor. But these habits, harmless on the surface, can eventually lead to being rushed to the hospital because of acute kidney failure, pulmonary edema, or arrhythmia caused by high potassium. Some people even end up needing emergency dialysis in life-threatening condition. Before I tell you the 3 fruits that damage the kidneys in people over 60, and the 3 fruits that can protect the kidneys with just small dietary changes, I want to say one thing in a Korean way. If this information helps you, and you want more practical guidance you can apply immediately to protect your family's health, please follow, subscribe, and leave a comment. If you want me to explain safe kidney diets in more detail, leave the number 1 in the comments. That lets me know you are truly interested, especially if you are worried about kidney health for people over 60. Now, before we go deeper into the fruit discussion, let me briefly introduce myself so you understand why I'm sharing this. My name is Yoo-Ho Jin. I am a specialist with over 30 years of experience, working at a university hospital. Over many years, I have seen countless older patients come to the hospital without realizing that the fruit they were eating daily had been damaging their kidneys. And what is truly painful is this. In many of those cases, if they had only understood how the kidneys work and how much weaker the kidneys become after 60, the situation could have been prevented. I still remember an older man who entered my office looking exhausted. He said this, "I eat very healthy. I eat fruit every day. So why do my results say my kidneys are weak?" When I asked what he ate, he answered like this. In the morning, bananas. At lunch, orange juice. At night, I eat 2 persimmons before I sleep. What he described is not very different from what many Koreans consider a perfect, healthy fruit routine. But for kidneys after 60, this combination can become a dangerous mix. I remember thinking to myself, if he had understood the physiological principles hidden behind these fruits, he never would have eaten like this. In reality, in Korea and in many other countries, medical systems tend to respond only after disease appears. Dialysis, surgery, emergency treatment. These all cost a lot, and they happen only when the condition has already become severe. But protecting the kidneys is surprisingly simple. You only need to correct the way you eat fruit. Yet most patients are never properly guided about this. That is why I want to share what I have learned over a long time with you, so that anyone can begin protecting their body starting today. Think of the kidneys of someone over 60 as a water purifier filter that has been running non-stop for 50 years. It still works, but its performance is greatly reduced. Now imagine continuing to strain that weakened filter with fruits high in potassium, sugar, and tannins. What happens? The kidneys collapse quickly. And when the kidneys weaken, the whole body begins to break down. The pulse becomes irregular, blood pressure rises, legs swell, kidney failure develops, breathing becomes difficult. But many people mistake all of this for simple aging. The good news is that fruit itself is not the enemy. You simply need to know the right types and the right timing. And in the next part, I will explain, along with scientific reasons, the fruits people over 60, or those showing signs of weak kidneys, must avoid. I will also share real cases from Korean patients I have treated. Everything I explain comes from real patient stories, stories that may reflect you, your parents, or your grandparents. Now prepare yourself after hearing what comes next. You may find yourself opening the refrigerator to check which fruits to keep and which to throw away. But that process is about keeping your kidneys healthy for the next 50 years. And I'm here to guide you through it, one step at a time. Whenever I tell patients that certain fruits can damage the kidneys, many of them widen their eyes in disbelief. They have always believed fruit is the healthiest food in the world, and that the more you eat, the better it must be. But after the age of 60, the kidneys can no longer tolerate stress the way they once could. Their ability to process sugar declines, their speed of potassium excretion slows, and they become far more sensitive to astringent substances like tannins. That is why fruits that appear harmless on the surface can place a heavy burden on already exhausted kidneys. Among the hundreds of cases I have encountered, 3 fruits have caused the most serious problems. I still clearly remember one autumn afternoon. An elderly woman named Kim Soon Ja was brought in by her son, almost carried into the emergency room. She was suffering from severe abdominal pain, continuous vomiting, and her stomach was so swollen that she could barely stand. She was in her early 70s, gentle by nature, and had always been very healthy. When I asked what she had eaten, she smiled awkwardly and said, "It's autumn, they were so sweet and soft, so I ate a few persimmons." The moment I heard the word, persimmons, the cause became clear. Persimmons contain a large amount of tannins. When tannins meet stomach acid, they can harden into stone like masses. In younger people, strong stomach acid and active digestion push these masses downward. But in older adults, stomach acid decreases and intestinal movement weakens. As a result, the mass continues to grow until it causes a blockage. A CT scan revealed a large gastric bezoar in her stomach. Fortunately, she came in early, and we were able to break it down through endoscopy. If she had arrived any later, surgery might have been necessary. Since that day, I have always told patients over 60 that no matter how sweet and delicious persimmons may be, especially on an empty stomach, they are not suitable. That same morning, after treating Ms. Kim, I returned to my office and met Mr. Park Cheol-soo. He was in his late 60s, solidly built, but his face was tense with anxiety. He complained that his heart was racing, his hands and feet felt numb, and his head felt dizzy, as if he might collapse. When I asked about his diet, he replied confidently, "I'm healthy, doctor. I eat 2 bananas every morning. They're good for energy and digestion. Bananas are rich in nutrients, but they are also extremely high in potassium. A single banana contains about 350 to 400 milligrams of potassium. For older adults with reduced kidney function, this is not a safe amount. When the kidneys cannot properly excrete potassium, it accumulates in the blood and leads to hyperkalemia. Early symptoms are subtle, tingling in the mouth or limbs, slight shortness of breath. But as levels rise, dangerous arrhythmias can occur. I ran tests immediately, and as expected, his potassium level was already beyond the safe range. If he had continued eating bananas every morning, a sudden spike could have stopped his heart without warning. Many Koreans believe bananas are good for muscles and nerves. That is true, but only for younger people with healthy kidneys. For those over 60, extreme caution is required. Another case involved an elderly woman named Lee Young-hee, who lived with her daughter in Seoul. She took good care of her health and believed that blending oranges or kiwi every evening improved her skin and helped her sleep. But when she came to the hospital, Her legs were swollen, she experienced mild breathing difficulty, her urine was foamy, and her blood sugar was unstable, despite having no diabetes. When I asked about her diet, she said she blended 4 oranges every night. They're high in vitamin C and good for the heart, she told me. The problem was not the fruit itself, but the form. Blended fruit delivers large amounts of sugar and potassium in a very short time. Rapid sugar absorption strains kidney blood vessels, and high potassium doubles the kidney's workload. In addition, acidic compounds stimulate the stomach at night, often causing reflux, coughing, and insomnia in older adults. Repeated exposure weakens the kidneys more quickly. In Korean households, it is common to place a plate of fruit on the table while watching TV. Persimmons, oranges, kiwi, strawberries, eaten little by little. It feels harmless. But this habit causes the body to absorb far more sugar and potassium than needed. Older adults often do not regulate portions because they believe fruit is always safe. After 60, fruit must be treated like medicine. Eaten correctly, it supports the kidneys. Eaten incorrectly, it harms them. One fact many people do not realize is this: unlike the liver, the kidneys do not regenerate. Once kidney cells are damaged, they do not fully recover. Every overload accumulates over time. Bananas, oranges, kiwi, and persimmons are not light burdens for aging kidneys. What is even more concerning is that many people are already experiencing early kidney failure without realizing it. They continue eating as they always have, until one day they arrive in the emergency room with arrhythmia, pulmonary edema, or dangerously high blood pressure. Seeing these patients has always been painful for me. Because if they had known how to eat properly, everything could have been different. Fortunately, not all fruits are dangerous. Some fruits actually support kidney health and reduce bodily stress. For adults over 60, these fruits can be eaten safely and offer real benefits. When I guide patients to replace harmful fruits with kidney-friendly ones, many show noticeable improvement within weeks, without medication. Now I will introduce 3 fruits that support kidney health and explain why they are particularly suitable for older adults. I will also share real cases of Korean patients whose health improved simply by choosing the right fruits. Please continue listening. What comes next may be the key to improving your kidney health and that of your family without medication. After explaining harmful fruits, I always reassure patients of one thing: there are still fruits that are safe and even beneficial for kidney function. After 60, the kidneys are like workers who have labored for decades. They need rest and gentle support. The right fruits reduce kidney burden, stabilize blood sugar, improve blood pressure, and lower inflammation. That is why I often begin by recommending apples. Apples are not overly sweet, have moderate potassium, and contain pectin, a soluble fiber. Pectin acts like a gentle filter in the intestines, slowing sugar and sodium absorption and reducing kidney strain. I still remember Ms. Kim Young-nan, a woman in her late 60s. She was constantly fatigued and had foamy urine. Her daughter brought her in, worried about her kidneys. She often ate acidic fruits, sometimes on an empty stomach. I advised her to eat half an apple about 1 hour after breakfast. She followed this advice. 2 weeks later, she returned with a soft smile. Her urine foam had decreased, and she felt less tired. This was not a miracle. The apple simply eased the kidneys' workload. Another fruit I often recommend is pear. Many Koreans enjoy its refreshing sweetness. Pears are rich in pectin and natural water content, increasing urine output naturally and reducing filtration strain. This is especially helpful for older adults who avoid drinking water. I once treated Mr. Park Jung, who barely drank water because he disliked frequent urination at night. His kidneys were under constant stress, and his legs were swelling. I advised him to eat half a pear at lunchtime as a natural hydration source. Within a week, his swelling reduced noticeably, and his body felt lighter. Pears also contain luteolin, a natural anti-inflammatory compound that helps reduce microvascular inflammation in aging kidneys. The third fruit I want to highlight is blueberries. In Korea, blueberries are often seen only as good for the skin, but their anthocyanins are powerful antioxidants that protect kidney microvessels. Importantly, blueberries are relatively low in potassium compared to other berries, making them suitable for weakened kidneys. I remember Miss Choi Soon, age 73. She was constantly tired, had unstable blood pressure, and frequent dizziness. I advised her to slowly chew a small handful of blueberries as an afternoon snack. After 3 weeks, her blood pressure stabilized, her head felt lighter, and her energy improved. Studies show blueberries can reduce CRP inflammatory markers by up to 20%, which is highly meaningful for elderly health. Once patients understand which fruits help the kidneys, the next critical question is how to eat them. Even healthy fruits can be harmful if eaten at the wrong time. I always remind patients that kidney function is strongest after meals and weakest in the evening. Timing matters. The first rule is never eat fruit on an empty stomach, especially in the morning. A sudden blood sugar spike overstimulates both the pancreas and kidneys. One elderly man in Busan used to eat an apple immediately after waking, believing it detoxified his body. After switching to eating fruit 1 hour after breakfast, his body stabilized quickly. The second rule is to eat fruit about 1 hour after meals. Partially digested food slows absorption, stabilizes blood sugar, and gives the kidneys more time to process. I often compare it to assigning work only after the kidneys are fully awake, not while they are half asleep. The third rule is no fruit after 7 p.m. Many Korean families eat fruit while watching TV at night, but after 7 p.m., metabolism drops sharply. Sugar and potassium accumulate, forcing the kidneys to work overtime all night. This is especially harmful for older adults. The fourth rule is to limit total daily fruit intake to about 200 grams. This equals half a small apple, 1/4 of a large pear, or a small handful of blueberries. Many people are surprised by how little this is, but for aging kidneys, it is the safest amount. The fifth rule is to split fruit intake into 2 portions rather than eating it all at once. Even healthy fruit can spike blood sugar and potassium when consumed in large amounts. I recall Mr. Han Do-yoon, who used to eat all his fruit at night. After dividing it into morning and afternoon portions, his health improved noticeably. With these 3 kidney-friendly fruits and 5 simple rules, many of my elderly patients have improved their health without medication. Please stay with me until the end. Now I want to share the final safety rules. Rules that anyone with weak kidneys must know. A single small mistake can quickly turn dangerous. After patients understand harmful and helpful fruits, I emphasize absolute safety guidelines. These are not suggestions. They are obligations. Because I have seen too many tragic cases. The first rule is to always check blood potassium levels. If potassium exceeds 5.0 mmol/Kl, even slightly, fruit intake must stop immediately. I have seen many elderly patients collapse from arrhythmia after continuing to eat bananas, melons, or orange juice without monitoring potassium. There are 3 warning signs of high potassium that older adults often overlook: sudden numbness, unexplained anxiety, and irregular heartbeats. These symptoms often pass briefly, so people dismiss them as fatigue. But I have seen patients arrive at the emergency room nearly unconscious due to sudden potassium spikes. If these symptoms appear, do not eat fruit or juice. Get blood tests immediately. The second rule relates to kidney disease stage. When GFR falls near 30, stage 3 or 4, even safe fruits must be reduced by half. At this level, even small amounts of sugar and potassium become burdensome. Mr. Park Young, man from Incheon, is a clear example. He ate half a watermelon every evening during summer. One day, he developed sudden breathing difficulty and was rushed to the emergency room. His GFR had already dropped near 30 months earlier. We reduced his fruit intake to 100 grams per day, split into 2 portions. 2 months later, his leg swelling and discomfort decreased significantly. Kidney function does not fully recover, but reducing workload protects what remains. The third rule applies to medications. Many elderly patients take blood pressure drugs, potassium-sparing diuretics, or certain diabetes medications that retain potassium. Combining these with high potassium fruits accelerates hyperkalemia. That is why I always say, even safe fruits must be limited if you take these medications. A single banana half or a glass of orange juice can trigger dangerous heart rhythm changes. The safest approach is to consult your primary doctor before maintaining a fruit habit. When explaining these rules, I always remember 2 patients. One was Mr. Park Young Man, who became afraid of fruit after pulmonary edema. He wanted to quit fruit entirely, but I explained fruit is not the enemy. It must simply be eaten correctly. I created a safe daily plan. Half an apple 1 hour after breakfast, a few blueberries in the afternoon, no fruit after 7 p.m., no juice. Separate fruit timing from blood pressure medication. He followed this strictly. 2 months later, he held my hand and said, "My body feels much lighter. Breathing is easier." That moment reminded me why I became a doctor. The second case was Ms. Lee Jung, soon from Anyang. She drank banana smoothies every night while playing with her grandson. One day, she nearly collapsed from dizziness. Her potassium level was already dangerous. She immediately stopped banana smoothies and switched to apples and blueberries. A month later, she returned smiling. "I can hold my grandson now without feeling dizzy." That relief still stays with me. After learning all this, many people ask me, what is the safest daily fruit schedule? For my answer is simple. For adults over 60, eat fruit 1 hour after breakfast. Do not eat fruit at lunch. Eat a second small portion between 3 and 4 p.m. Absolutely no fruit after 7 p.m. If you take blood pressure or diabetes medication, keep at least a 2-hour gap. Following these principles greatly reduces kidney strain. After caring for hundreds of elderly patients, I am certain of one thing: changing how you eat fruit can dramatically improve health. Fruit can be medicine or poison. The key is not how much you eat, but when, what kind, and how. The kidneys work quietly for a lifetime. They deserve gentler care. Thank you for listening until the end. I hope this information helps protect your kidneys and those of your loved ones for many years. If this was helpful, please share it with others. A small change can prevent a serious mistake. Thank you. In the next video, I will continue sharing overlooked but essential information for protecting health in older age.